So, hi, I'm Mark Hancock, and this is
Sue Cradock, hello.
and we're part of taking control of your health. And we thought it'd be a really good idea to have a bit of a chat about our backgrounds, why we're doing all this. And Sue, you've been in diabetes care for a number of decades.
A number of decades, I think that's probably fair to say. Yeah, since probably, well, I was a ward sister in the early 80s. I won't tell you when I started nursing, but I was a ward sister in the early 80s and then became a specialist nurse in 85. And I've worked in hospital settings, community settings, primary care settings more recently, which is where I learnt about the stuff that we do, but all the time as a specialist nurse. So a lot of interesting experiences. I met a lot of people with diabetes.
Yeah, and you were involved in a number of projects as well, weren't you? Was it the Desmond's project?
Yeah, I was very fortunate to be part of a group of people that were keen to try and promote self-management education across this country, and the Leicester Diabetes Centre managed to find some funding and brought many of us who were running programmes. We were already running one in Portsmouth at the time, but brought a few of us together and we collaborated and put the best bits of each of our programmes together, and that became the Desmond programme. And then there was a big piece of research around that, got it rolled out across the country, and I was a trainer and an assessor for that, and then ended up doing a PhD around how well should nurses and dietitians work in helping people learn in a group.
Yeah, fantastic. And I suppose you were doing all of that, and then you ended up back in primary care, is that right?
Yeah. I mean, I thought I was going to retire,
Right.
Marcus. So I thought, I did my PhD and thought, okay, it's time to just do other things now. And then I got a call from a local surgery who had heard that I might have some hours to spare, and they needed some cover to help them with people with diabetes during maternity leave. And I went, yeah, okay. And then ended up working with them for probably, it must be 10 years. In fact, we're doing some work with them now again. But it was there that my eyes were really opened about type 2 diabetes, as
Right.
you know.
So, and what were you sort of discovering compared to, I guess, the exposure to diabetes you'd had before?
So I think when you work in a specialist team, you didn't always see people with type 2 diabetes in the early stages. You usually saw them towards the end of their treatment journey, if you like, when insulin was needed, or when there were other things going on. And so I think I hadn't realised how much I want to say ineffective, and I shouldn't really, because the drugs do work for many people, but then on their own they don't. And I think it was in primary care, because I was seeing everyone with type 2 diabetes in that surgery. I was going, the drugs that we're using make a difference to the numbers, very much like Dr. David Unwin found. They bring the numbers down, but their bodies weren't changing. People were still struggling to lose weight. As we know, it can be a bit of a battle. And more pills were being used. At the time when I started there early, and I was around in diabetes when the big studies were saying type 2 diabetes gets worse, and we're going to obviously have a conversation about that with you. But and then I started to think, actually, does this have to be like this? And I was still interested in the national agenda, and you could see that there were some people that were going, it doesn't have to be like this. It looks like there is hope for some people, but actually it's about lifestyle. Now, I then realised we as healthcare professionals don't do a great deal around lifestyle. We really just we majorly supported the use of drugs. And I thought, this isn't the best way for me to work with people with diabetes. It's fairly easy to write a prescription, and there's nice guidance that tells all the nurses and doctors what to prescribe next. And we know that people struggle taking those drugs. So, and sometimes don't, and sometimes do. And I just thought my work should really be about helping those people that I'm seeing regularly do what they want to do and think about whether they make changes in their lifestyle. And one of the big things for me was, if you've got type 2 diabetes, then you've got insulin resistance. That causes you to have high insulin levels, which if you feed yourself with carbohydrate foods that end up as sugar or glucose in your blood, if there's lots of insulin around, which there will be, it'll store it as fat. So why are we still encouraging people to go high carb, which is what the dominant message has been? And I started to help people think this through and monitor themselves, and people start to have amazing effects. And then I thought, I have to get to more people somehow. So I started to discuss this with the local surgeries. And then I think I need to hand the baton over to you now, Mark, because of course that's when you and I met, wasn't it?
So you were a little bit ahead of your time, really, weren't you? Because, I mean, I remember in my obviously my personal situation being I was 39, just diagnosed type 2, young children, thinking, oh my God, what's my future going to be? I was told the condition is only likely to get worse. I was told that my medication needs will go up as the years go by, and I'm thinking, well, I was hoping I was going to have a nice retirement. I was hoping I was going to see my children grow up and get married and have grandchildren and all that sort of stuff. And suddenly that hope had been kind of taken away. And I was put on medication straight away. And I threw myself into everything I was told at the time. So, you know, we were told about the Eat Well guide. I made some changes there in as much as I was switching from white bread to brown bread, and I was changing from rice to basmati rice, and not only myself but my children were. We the whole family, the wife, she made those changes.
Doing as you were told.
Doing as told, and of course then I started doing exercise as well, and I thought, you know, we're told to do the exercise, so it will be a good thing to do. And did the Couch to 5K. Suddenly I was able to run many miles a week, doing lots of exercise, but at the same time, although my condition appeared to be getting better, I thought it was getting better because I kept being told at the annual review that my condition was, I guess, stable at the time, and they said, you know, oh, if only all diabetics were like you. And I didn't really know what that meant, except I thought, well, yeah, clearly I must be doing the right thing. I'll keep doing
as you were told.
And that, yeah, absolutely. And I went on to do that for 6 years. So I got to 45, and then they were saying, oh, actually your condition's getting worse. Your diabetes numbers are going up. You're putting on a bit of weight. We need you to take more pills. We want to put you on cholesterol pills. And I just remember being very frustrated at the time, because I'm thinking, I'm doing everything. I'm doing everything you told me to do. I'm eating the foods you told me to eat. I'm doing way more exercise than probably what the average person is doing. Why is my condition getting worse? And of course, you know, they just said what they said right at the start. Well, we always told you it would be chronic and progressive. And I sort of went away I remember going away that summer feeling a bit disillusioned, thinking, well, you know, I don't think I can do anything more than I am actually doing. Of course, I come home, come back to work, and I'm listening to Michael Mosley, the TV doctor, and he's on the radio on the Jerry Vine show, and he's saying, actually, perhaps we've got this wrong. Perhaps the foods that we're recommending people to eat are actually worsening the condition. And of course, I was left in a position where I thought, well, I've got nothing to lose.
Yeah, absolutely.
Because they're telling me it's getting worse anyway. And he brought out a book, and I thought, well, I'll give it a go. Doesn't matter what the food tastes like. It's probably going to be awful, but yeah, let's give it a go. It wasn't. I learned to cook, started making little simple meals, and felt better. And I was tracking it, because I do like tracking things. So
You're a numbers man.
The numbers man, yeah. So I started looking at those, and my numbers within a couple of days was so much better, and they had fallen back into
that quickly.
A couple of days. And I'd already spoken to my nurse at the time, so this is a different nurse, a younger nurse, and she said, "Oh, go for it." And so I thought, well, I better ring her at the end of the week and tell her how I'm getting on. And then and I said, look, I'm getting numbers now that are saying, you know, 3.8, 4.2, things like that. And she said, okay, that's fantastic, and you can stop taking the drugs. And, you know.
How did that make you feel?
Wow.
Yeah, wow.
Because, you know, what was it, 2 months before?
Yeah.
They said you have to have more drugs.
Yeah.
Not you can stop them.
And you'd switched it.
Switched it.
Just like that.
Within a week.
Yeah, within a week.
Within a week.
Now that is
and
hope,
she said,
isn't
just
it?
keep tracking it, keep tracking it, and as long as you stay where you are, then all is good.
And how long ago was that?
That was 7 years ago.
Yeah.
7 years ago, and you tweak things, don't you, as you're going along. But I've never felt better. I feel better at 52 years old than I did at 22 years old.
Wow.
I'm absolutely sure that I'm doing everything I can to make the best version of myself at 52 years old. And of course, so that's, you saw me standing up. I mean, I was on a bit of a mission, wasn't I?
Yeah, you were certainly,
to help people.
and you still are, but I think we're both on a bit of a mission. You've got a wee bit more energy than me. That's nothing to do with age, of course, probably is. But there was no doubt, I kept seeing you I saw you a couple of times. I saw you when Michael Mosley came to Portsmouth. You came up at the front. He knew about you, so he pulled you up, and that was lovely. He was there having broken his leg or something on a skiing accident.
Yeah, because I think he likes running, doesn't he?
Oh, was it? Yeah.
But he couldn't do it for a while.
Whereas fortunately you weren't like that. You stood up. And also I've seen you talk to a local diabetes forum, so to nurses and I don't know if it was nurses and doctors, or it might have been at a local conference. And I was thinking, this chap's got an amazing message. And of course it fitted with what I was doing. I was very aware of my peers at the time being a bit nervous, and I heard you say you really wish that you want to help other people, and it looked like you wanted to find a way in to help people like me get to more people. You wanted to spread this word. And I also realized that people like me, certainly at the time as a nurse in a surgery, we were seeing all these people, some of whom may want to take this on board, and how do we help? And I think that's where I decided. I did ask some of my colleagues, as I've told you before, I asked some of my colleagues, why hadn't they taken you up on their offer? So I feel really pleased that they didn't. But I was curious about why they hadn't. And I think their response told me at the time, it's probably less so now, how nervous healthcare professionals were, because they said that you were a bit evangelical about this. Whereas, of course, I loved that. I thought we have to be, don't we? I think this was many years ago now, wasn't it? Probably 4 or 5 years ago. Well, probably not, probably about 4. And I remember ringing you up and thinking, I'm going to go and check this out. Can I have a
for a cup of coffee, didn't
I
you?
did, yeah. And we just sat talking, and I thought, and I think I've been pretty good at spotting people that may not have the most appropriate message, whatever that looks like. But I never thought anything of you like that. And I thought the world does need evangelists at the moment. It does need somebody with your lived experience, and I think that was the thing for me, and clear messages that was in line. You were not going off piste. That was in line with other things that were happening, across this country medically. So we know that David Unwin was also doing a similar thing with the people in his surgery and making a difference. And that's who has helped me go, I can do this. Unfortunately, the GPs in my surgery were going, yep, we trust you, Sue, off you go. And they saw the evidence because we did a group together, didn't we? Well, actually, the first thing we did was I got you in front of our local practice.
You asked me to come along, didn't you?
I did, because they were knowing what I was doing, and I was thinking, I wonder if they would be interested in us doing something with you. So I brought you along. And
you sort of said, right, go, wound me up, off you go. And I just sort of told them my story, just pretty much like we've just been going through now. And I think by then, even then, people had been coming to them and saying, oh, tell me about remission, tell me about low carb, because it was starting to be in the news and in the papers, that type of thing. And I sense there was almost a bit of a lack of confidence, in as much as not lack of confidence in it working, but a lack of confidence in understanding it enough to feel confident in talking to
and
the
how
patient.
to help other people.
So we just naturally thought, well, why don't you all try it?
Yeah, we did.
And then,
can I just, before we go on to what we then did, I think the other thing that was happening to me and to other nurses, and why they were open, is that they too were feeling the lack of hope in type 2 diabetes. And we know that David Unwin felt like that. And there's no doubt, if you've worked in a surgery for many years, working with people with type 2 diabetes, in a system that is constantly just about drugs and numbers, I'm not saying that's trivial surgeries, but actually after a while you get burnt out, you get really exhausted with what's happening. And we know that most follow-up is done by nurses, and nurses do their best to help, but they just knew, and the nurses I worked with then, they just knew that there needed to be something else to give them hope and joy in their job, and we know that this has happened. So what did we do then, Mark?
So we decided to run a little group, a WhatsApp group actually, wasn't it, to start off with? And we ran a couple of sessions just for the nurses.
We put together the course in some ways, didn't we?
Yeah, at that point, we were putting it away. We were sort of developing it, weren't we? While we were doing it with the nurses.
See how this works.
See how it works. And of course, then we walked straight into the pandemic.
We did.
Second
course, face to face. No, it's not happening.
Before you know it, we're on Zoom.
We're on Zoom.
And of course, which, you know, funnily enough, actually has had worked out really well, because it's been able to bring a lot of people together from all different areas, and have that opportunity to meet up and not need to worry about arranging rooms and technology and all that sort of stuff. Not so much anyway. So that worked out really well. We just transferred onto Zoom, and then it wasn't long before they started feeling better themselves. Because this is obviously a benefit, not necessarily just to pre-diabetics, diabetics. Anyone can see some benefit.
Not just to patients, but actually to healthcare professionals as well.
Healthcare professionals.
We all struggle with the same thing.
So I remember there was one particular nurse, I think she lost a few stone.
Yeah, she did.
Another, I think, had someone in the family, I think was type 2, and they were trying to help them. So we were starting to see the benefits of it just amongst the nurses. So it didn't take too long before we really nailed down that course, and put that out and said, right, okay, let's see if we can get this in front of patients now. Let's see if we can put this together for the patients. That happened at pretty much at the start of the pandemic. I think it was about the April time. We had our very first course.
It did.
3 years ago.
I think I'd like to pay tribute to the local GPs, really, because it wasn't just one surgery. There was, we'd managed between us to get the group, the primary care network of surgeries, which at that time was about 9 surgeries, to agree to let us do this. And I mean, whilst they gave me my time to do it, and the nurses, because we wanted the nurses involved, you gave yours time free for quite a while, didn't you? So that was, but I think to pay tribute, they supported us to keep going with this,
absolutely.
Didn't they? Wholeheartedly.
It felt like that right from the beginning. It was a case of let's give it a go. We'll support you. And the nurses were really keen to support us as well. And I think the team that we ended up, I ended up working with, were absolutely fabulous. In selling the concept really to the patients.
And that was part of the reason we wanted the nurses involved, wasn't it? Because I was very aware that over the years, and including the Desmond programme, if you just tell people it's there, unless they're bought into it, you don't get as many referrals. So you have to, the people who are the referrers, and in our world at the time it was the nurses, still is, they were the people that were seeing people with type 2 diabetes, and we wanted to get their hearts and minds engaged in this, so that whenever they saw someone, it was an offer on the table, ready. And we were very fortunate that the PCN, the GPs surgeries, supported the nurses to be part of it each time. And we still have that, don't we? They still support you. So I don't have to be there at every course, but they're there, and they're learning.
I have a nurse with me on every session. And do you know what the thing that comes across from the nurses team particularly is when the patient goes back to see them. The feeling that when they can say, well, this is what the blood work looks like. Your diabetes, maybe it's in remission, maybe it's improved, maybe we can reduce some of that medication. And I know they get a real sense of joy of being able to deliver that news to the patient, and when you speak to them, they think it's wonderful.
So they believe. So they're now doing a job that they love, or so it gives them hope. As we said right at the beginning, it gives them hope with the work they're doing, and so they want to help people keep it going.
It's been great. So we've been doing this now for 3.5 years.
3.5 years, and of course, as politically, there was a bit of a change in the primary care groups, wasn't there, or primary care networks, and we worked with one for a while, so we were split off, but we've managed to go and work with the other one as well. So we're still working with the same groups of surgeries. And I think, I mean, if I had a wish, it would be that we could gather data much more easily, but we're slightly outside of the data collection system. But we did collect data for the first year, certainly from one surgery, and that's probably what impressed them, and they went, fine, carry on.
Keep going, keep up the good work.
Keep up the good work, so we do that. And for any healthcare professionals that are watching this video, we still support the fact that people can be referred to their local diabetes specialist nurse program. So don't deliver Desmond locally anymore, but they've delivered an alternative. And of course, we've got the diabetes prevention program locally, and we accept that people should be referred to that as well. And we're having conversations with them about their messages around this approach, and I think it was quite positive the other day, wasn't it, that they were open, that they're open to this. They realise there's a common sense about it.
So what's the future then, Sue? So what are we looking at doing now? What's the future?
Well, as you know, because of what we're doing this for, is that you and I have decided that we need to see if we can reach more people. Now, we're not desperate to change the whole world, because I think there's a tipping point occurring in this country where low carb, helping people, low carb's a bit of a misnomer, because it's not very low carb, and it's not just low carb. It's actually about when you lower your carbs, you then have to think about what protein you have to have and how you're going to increase your healthy fats, otherwise you'll be hungry. So we know that there's this message that is now coming out from all sorts of areas across the world, locally, nationally, and guidance is beginning to encourage the use of this approach. But as you and I know, that needs support. It isn't just about prescribing a lower carb approach. The people that we've met, our program is 12 to 14 hours of education over Zoom. It's not directly given. I mean, you deliver most of the content, but you use videos from online, from the experts out there. And then we encourage people to discuss their goals and explore their progress, talk about the barriers. But we want to reach parts that other places might not be able to reach. So that's why
every now and then we'll get people that will come to us and say, oh, I wish I was in your area, because we'd love access to your course. But unfortunately, my surgery doesn't run it.
No.
Not yet.
No.
So I guess that's where our focus is at the moment, is to try and get out to those people and say, well, okay, we can lay this course on now. We're able to do this for the wider public across the UK. And so you can log on, you can book on the course, and our next one starts in October.
It does.
Which will be really exciting, and you and I will be running it together, which will be fabulous.
The
dream team.
The dream team. Yeah, the dream team.
So that'll be really exciting. And I just wanted to, before we sort of finish, just touch a little bit on what we discovered whilst we were doing the courses. Now, I think the courses have been great in as much as you get that peer support. You get, everyone's sort of in the same boat. They're all working together, and I think there's a real lot of success that we get from that. But also we discovered that there were some patients that, or people that have gone through the course, that they know what they should be doing now, and they've got their knowledge now. The knowledge is right, but something in their heart is blocking them or stopping them from being able to be as successful as they want to be when it comes to their goals. And so we've recognised that on a local basis. And could you talk a little bit about particularly what you're doing? Because it's very interesting.
Yeah, well, I suppose I'm doing what I've always really wanted to do in my career at this end. So I'm spending a lot more time coaching people, and at an emotional level, really, but not being a counsellor. I'm not a psychologist. I've got, I'm a well-experienced diabetes nurse, and that experience has made me realise over the years, just telling people what to do don't work now. It did in your world. That's what's always fascinating. There are some people that it does work for, right? Yeah. And although eventually you were going, this isn't quite working, and you found something that did. So you're what I'd call highly activated, and there is some research out there that talks about there are people that are highly activated, and you just need to present them with some information, seems to make sense, and they'll be off and running, right? And it was for you, literally, you were off and running and still are. But there are also people in 2 or 3 other groups. There's a group of people that will probably never be able to take on major change in their life because of all sorts of things that are going on in their world at the time. And they may be people that wouldn't even want to access our course. But there's a number of other people that over the years, I've modified the way I work as a nurse to be much more someone that helps people really think through what do they want to have happen. And usually people will start, so I now do, as you know, one-to-one coaching. Fortunately offered it because I've qualified as a coach. dropped my nursing bit within the GP surgeries, but working nicely as a coach because that gives me a wee bit more time. And I work with people that have done the course and are going, Mark, I just can't seem to get my head around what I'm meant to be doing, because I know what I should do, but as you say, something's getting in the way. And so I work with those people. Sometimes it's just one session, sometimes it's 6 sessions. And we meet usually on Zoom because it's so much easier for everybody, given the Hampshire countryside that we live in, the north of Hants down to the, not quite the south, but not far. And I think what I've learned from that is that if people really want to do this, they will find a way, but they haven't had a lot of time to think about what's getting in the way. And so I get in the room with them, or in the Zoom with them, and help them really think about and define and almost turn it into like a metaphor of what they'd like to have happen, and what might be getting in the way. And then all of a sudden they can see how to tweak it. So people start to talk to me about, I want to get back on track. And so we talk about, well, what sort of track's that track? And then that brings out something. And then they realise there's something else going on for them. And they said, but this bad person makes me want to go to the fridge. Okay, and so I said, well, when you're the bad person,
one of them bad people. Huh?
When this bad person wants you to go to the fridge, what would you like to have happen? And they go, I want the good person to come out. So we start exploring, and when we bring these things to life, they go, okay, I need to pay more attention to that. So we spend a few sessions thinking about that. But there's also been a couple of people that were not convinced it was the right thing for them. So we started to explore, and they said, I'm not convinced. Yeah, I think they said things like, I'm not convinced that this is the right thing. Probably took a couple of sessions to get to that point, because I think they thought they should be getting there. And then because of the non-judgment and the trusting nature that I'd like to think they got with me, they said things like, do you know, I don't even believe this is the right thing. How do I know it's the right thing for me? So we'd have some conversations about, how would you know it was? What would it look like? And also I'd introduce them to this notion of risk, and helping them, as we do on the course, helping people really make an informed decision. So I know that some of my coaching leads us to have a discussion about risk. I don't act as a nurse, but I act as a coach, helping them think about making an informed decision. So there's 2 aspects that seem to come up, but it's what's keeping me enjoying my work at this great age. But yeah, so I offer that, and of course we know that from the literature. So as I've said, I was an academic for a while. I did a lot of work around, and still are. In fact, someone has just messaged me to say, could they have one of their colleagues have a conversation, because they're doing a project about why people don't follow the advice that they're given. And I'm thinking, we are 30 years on from when I started, 30, 40 years on from when I started doing this work. We still haven't realised that it's probably the model of care that is designed to give people information, designed to tell people what to do. And that actually for many, in order for them to make big lifestyle changes, they've got to be a bit more convinced than that. And so we found that within our groups, you know, that there are people, and of course there's the notion of carb addiction. We haven't really mentioned that, but we live in this world of foods that are highly refined, and we know that as soon as you start to have carbs, especially if they're combined with the right amount of fat, food industry has worked that one out, we just want more. We just want
drives
more.
us to overeat.
Yeah. What did you say then?
Drives you to
Drives
overeat.
you to overeat. It does. And I think people are now.
Who can just have one biscuit?
Yeah. Well, I suspect you might be able to now. No?
No. Well, I don't have any biscuit. My wife will have one biscuit.
Okay.
And I just think, well, I can't.
Yeah.
I have no biscuits.
Well, I have biscuits in the cupboard, so I'm generally low carb. I have packet biscuits in the cupboard, and as long as they're not opened, they're there for my other half. As long as they're not opened, I'm okay.
Right.
It's if they're opened.
Yeah.
But I can usually limit myself to one.
Right.
And I think that's probably because I've been giving this message a long time, and I really want to do the best I can for my health as I get older. So, so we offer one-to-one coaching, and of course you're beginning to pick up one-to-one coaching.
Oh,
as
absolutely.
well,
And I'll probably do it slightly down. I think the way we do it.
What we haven't said is that we managed to persuade the NHS to hire you as a coach.
Oh yes. So I'm no longer voluntary.
No, you're no longer voluntary.
So
within a few months, I kept saying, if we don't employ Mark, we'll lose him, because I kept thinking that other places around the country, or not country, but the locality would would see what we were doing and want to grab you. So
and
fortunately,
it's been wonderful because it's given me a great opportunity to get in and see what the challenges are.
and you did some training.
Yeah,
So
did
we
some
got you
training, so I got all
qualified, yeah.
qualified and
Yeah.
everything else, and so it's been an absolute delight. And who would have ever believed, or I certainly would never have believed when I started off working at Lloyd's Bank all those years ago, that I'd end up working for the NHS. I mean, what a complete change. And I've always said type 2 diabetes was probably the best thing that ever happened to me.
Yeah.
Which, because you've got to look at things positively from time to time and think, well, that was for a reason.
Yeah.
And now I've discovered exactly what I want to do for the rest of my life. These are the things that I want to get involved in.
Yeah.
So we talk about the one-to-one coaching, and you obviously can book with Sue, and I do one-to-one coaching as well. And I'll probably offer a slightly different kind of service, and that may be for people that are not necessarily wanting to do or be educated as part of a group. Sometimes people don't. People would like to just have that one-on-one education, of course. So
there's fairly highly activated people that just want, show me this information and help me put the
Let me ask some questions.
together.
I don't want to listen to everybody. I just want to be able to ask you questions
there we go.
and go through it, and then right, I'm off. I'm off.
Yeah.
So I think what we both bring, we bring something slightly different, and hopefully that will appeal to a lot of people.
Yeah.
So yes, so that is the future for us. We hope you've enjoyed the video. We look forward to seeing you soon. Don't forget, we've got the low carb group starting in October. If you'd like to log into that, that will be fabulous. And we'll see you all soon.